In Chapter 12, understand the general trends in drug use and abuse, including emergency department admissions and drug abuse deaths, and also know about the information provided in this chapter about the use of heroin and OxyContin. The topic covered in Chapter 13 is very important to medical treatment. You should begin by knowing the classes and names of medications used in pharmacotherapy, be able to distinguish between those, understand the treatments for the specified clinical syndromes such as alcohol withdrawal, understand the type of person that would be a good candidate for methadone maintenance, know the meaning of common prescription abbreviations that are listed in this chapter, and know what common prescription medicine does, as well as common side effects of those medications and treatment. For example, sudden alcohol cessation or reduction by an alcohol-dependent person can result in a cluster of symptoms referred to as alcohol withdrawal syndrome, which can include minor symptoms of rapid pulse, sweating, nausea or vomiting, or major symptoms such as tachycardia, hallucinations, grand mal seizure, and delirium tremens. Methadone is an FDA-approved medication used for opioid detoxification, which is substituted for the heroin or opioid being abused and is gradually tapered to minimize withdrawal. Lithium is used to treat manic depressive illness with side effects including muscular weakness, fine hand tremor, and facial spasms. And antabuse is known as aversion therapy for alcohol abuse because it blocks the oxidation of alcohol and causes unpleasant to severe reaction when taken with alcohol. And the longer the therapy is used, the more sensitive the person may become to alcohol. Know about the meaning of common terms and the types of treatment associated with holistic approaches to recovery. Be able to distinguish between them. For example, understand what acupuncture is, what functional hypnotherapy is, and be able to distinguish between the characteristics of each of those approaches. And finally, in this chapter, within the section titled Effects of Drugs on the Body, know that the syndrome known as wet brain is due to nutrient deficiency, and that this chronic brain syndrome is caused by long-term alcohol abuse. In Chapter 14, know the important background information about medication-assisted treatment, including the percentage of the population that is vulnerable to opiate addiction. Know the relapse rates of opioid-dependent individuals, and know how methadone affects patients suffering from opiate addiction. Know that short-acting opioids develop rapid tolerance. Know the information in the pharmacology and pharmacotherapy of this chapter, as this relates to opioids. Know the time it takes methadone to leave the body and the factors that influence that time. Know which medication maintains patients in a lesser degree of physical dependence, and know which medications may cause lethal effects when combined with opioid treatment medications. Know the common side effects associated with opioid replacement medications, and know and be able to distinguish between the stages of pharmacotherapy. For example, if the question asks at what stage of medication-assisted treatment is the goal to eliminate craving, the answer would be destabilization. Also know the information in the screening, admission, assessment, and admission section of this chapter. There are a number of common components regarding, for example, screening, regardless of the type of client that comes in and regardless of whether or not it's a methadone maintenance program or a medication-assisted treatment program. But if this question is asked on the exam and it wants you to answer specifically that it relates to a medication-assisted treatment program, the question will ask, for example, what is the first opportunity for the medication-assisted treatment provider to establish report necessary for therapeutic alliance in an opioid treatment program, and your answer will be initial screening. So you should know and be able to distinguish between screening, assessment, admission, components of medication-assisted treatment programs, and one of the specific things that you should know in this chapter is when the initial dose of medication-assisted treatment should be administered once a diagnosis is made, and that patients are at a critical phase until their body achieves a steady state. In Chapter 15, know that relapse is a typical component of the recovery process. There are high rates of relapse among alcoholics, tobacco smokers, and drug abusers, and this has been documented in numerous studies, and most clients will relapse within 2 weeks after completing treatment. For example, one study of relapse following smoking cessation reported that 63% were smoking 2 weeks later. A review of several alcoholism studies reported that more than 3/4 of subjects relapsed within 1 year of treatment. And another study reported that the highest rate for relapse is experienced with tobacco dependence, with relapse rates of 75 to 80% within 1 year of tobacco cessation. Know that the focus of relapse prevention is to reduce the risk of relapse by addressing potential triggers and high risk factors. A relapse trigger can be any person, place, thing, or situation that reminds a person of their prior substance abuse. Know that numerous reports confirm a positive correlation between abstinence from alcohol, drugs, and tobacco, and the presence of strong family and social supports. And finally, know that the acronym HALT, or HALT, used in AA and NA reminds the recovering substance abuser to stay away from negative emotional states by not getting too hungry, angry, lonely, or tired. In Chapter 16, know the information which relates to fetal alcohol syndrome, hepatitis, AIDS, HIV, and communicable diseases topics. Know what FAS is, as well as its consequences. Understand the differences between universal, selective, and indicated prevention strategies for FAS. Know the characteristics of the hepatitis virus, and know and understand that the correlation between alcohol abuse and the increased incidence of high-risk sexual behaviors in contracting HIV. And then starting with the article titled Alcohol and Hepatitis C, through the end of this chapter, there are a number of things you should know. We are going to give you the questions you should know and to which you should know the answers by reading the rest of this chapter. You should write these questions down and then be able to answer them. How can alcohol consumption exacerbate HCV infection and the associated liver damage? HCV infection is becoming a leading cause of what? There are several things that will be correct, including psoriasis and liver failure. In 1993, what qualifier was added to diagnose AIDS? What is HIV? Know what the complete name is and what it causes. Know that people with alcohol use disorders are more likely than the general population to contract HIV. HIV is most commonly transmitted by sexual contact and the sharing of contaminated needles by injection drug users. Alcohol use can increase susceptibility to which infections that can occur as a complication of AIDS? You should know the answer to this. What is a disease common to needle users caused by endotoxins that produces symptoms similar to a very bad case of influenza? And finally, in this chapter, know that most communicable diseases will start slowly, but then rage through the most susceptible groups. In Chapter 17, know the incidence of death and the increased cost to employers from cigarette smoking, and also know what nicotine does physically to a person as well as the associated diseases, and be able to identify diseases associated with smoking. Know that increased cholesterol levels and decreased circulation can also be attributed to the use of nicotine. Know the physical risks that are faced by tobacco chewers. Know what supplements may be used during withdrawal and detoxification from cigarette smoking. Know what may be helpful in preventing weight gain associated with stopping smoking. Know what supportive therapies may be helpful in stopping smoking, such as acupuncture, hypnosis, and massage therapy. Know what recent studies suggest may make people vulnerable to both alcohol and tobacco addiction. And finally, as reported by the National Institute on Alcohol Abuse and Alcoholism, know that more than half of patients in treatment for alcohol and other drug dependence die from tobacco-related illnesses. In Chapter 18, know whether eating disorders generally co-occur with alcohol and other drug use disorders. Know the general characteristics of anorexia and bulimia, as well as the general age at onset. Know what the term comorbidity means and how it is used related to eating disorders. And know what common questions arise when treating co-occurring alcoholism and eating disorders. And know what is generally regarded as the first-line treatment of choice for eating disorders. In Chapter 19, know whether dopamine and serotonin relate in any way to pathological gambling. Know the 10 identified behaviors, 5 of which must be exhibited, for pathological gambling disorders diagnosis that are listed in the DSM-IV, and know whether gambling problems among those in treatment for substance abuse are generally the same, lower, or higher than in the general population.